You're listening to Beyond Borders, the Immigration Evaluation Podcast, the go-to podcast for mental health professionals who want to be expert immigration evaluators. I'm your host, Dr. Mariella Shibley, and I'm here to help you turn your expertise into impact. Let's get started. Hi, everyone. Today I want to talk about something that honestly caught my attention. I recently had a consultation with a mental health professional who received feedback, either an RFE or from a judge, saying that her evaluation wouldn't be given much weight because she relied on self-report measures. And that raises a really important question. What do we do when an adjudicator questions our methodology? Because if it hasn't happened to you yet, I do think that we're going to start seeing more of this. Adjudicators are scrutinizing evidence a lot more closely and in some cases looking for ways to discredit our opinions. So what do we do? To really understand this issue, we need to start with the legal foundation, and that is how expert opinions are evaluated in the first place. So the federal rules of evidence are a set of guidelines that determine what evidence can be used in federal courts and how it should be evaluated. And the goal is to help ensure that expert opinions, like ours, are based on reliable methods and are relevant to the case. So under Rule 702 specifically, an expert can offer an opinion if their knowledge will help the trier of fact understand the evidence or determine a fact in issue, their testimony is based on sufficient facts or data, their testimony is a product of reliable principles and methods, and they have reliably applied those principles and methods to the case. Now, yes, these are federal rules, and immigration court is its own system, but immigration is federal, and in practice, these standards absolutely influence how our work is evaluated. And what that means is that we are the experts on methodology, not the adjudicator. So now let's talk about testing, because this is where the criticism came from. I always say that psychological testing is the spice. It's not the main dish. We do not, and ethically cannot, rely solely on tests to arrive at conclusions. That would violate every major set of ethical guidelines in mental health. All major guidelines, including the APA guidelines, make it very clear that conclusions must be based on multiple sources of data. We didn't spend years in school. We didn't complete supervised hours and obtain licensure, go through all that process just to administer a questionnaire and call it a day. If that were the case, then there would be no need for us. So now let's address the actual criticism here, because this is where things get interesting. The issue raised was that the evaluator only used self-report measures. But here's a reality. Most symptom assessment tools are self-report. Even the ones that people consider the gold standard, like the MMPI or the PAI, they are still self-report measures. Yeah, they include validity scales, they can detect exaggeration or minimization, but at the end of the day, this person is still the one marking their own responses. So if the expectation was, well, you should have used something more objective, like the MMPI, well, that ultimately reflects a misunderstanding because it's still self-report. And that brings us to another big issue. Self-report is inherently limited. So let's say I'm depressed, but I don't think I'm depressed, right? So maybe I'm in denial. Maybe I have a tendency to minimize. Maybe I somatize my symptoms. I have a tendency to present as stoic. And then you give me the Beck Depression Inventory or the PHQ-9, I'm probably going to score low. And not because I'm fine, but because I lack insight. I'm not aware. Now flip it. If I want you to believe I'm depressed, well, easy, I can score high across the board. Now, does that mean that I meet criteria for major depressive disorder? No, not necessarily. Maybe I'm exaggerating. Maybe there's a secondary gain. Maybe I'm anxious that you won't believe me. We see this all the time in immigration evaluations. So these measures are influenced by insight, personality style, cultural factors, fear, anxiety, sometimes secondary gain, which is exactly why we never rely on them alone. Even with more objective tools like the MMPI or the PAI, that would still be unethical. Now, in my own practice, I like to use the SCID, which is the Structured Clinical Interview for DSM-5 disorders. And that does add another layer because I can ask follow-up questions, I can clarify inconsistencies, I can explore symptoms in more depth, I can ask things that aren't always obvious to the person. So yes, you could say that introduces a bit more objectivity. But even then, it is still based on the person's report of their internal experience. There is no psychological measure that completely bypasses that. There's no blood test. There's no MRI of the brain. Well, you might argue that there is, but we're not doing that for immigration evaluations, right? So what's testing actually for? I want to take a moment to share my online directory of immigration evaluation providers. This is a curated network of clinicians who have been trained in this work and meet a high standard of quality and professionalism. It's a great way to increase your visibility and connect with attorneys who are actively looking for qualified evaluators. If you're interested in being included, you can find more information in the show notes. Now let's get back to the episode. Testing adds value. It gives us structure. It gives us additional data points. It gives us insight into response patterns, information that we may not have gathered in other ways. But it doesn't replace clinical judgment. It complements it. Again, like spices in a recipe. You can eat a plain chicken breast, totally fine, it's edible. But seasoning it enhances it. But still, the spices are not the meal. And here's another key point. In some areas, like competency evaluations or violence risk assessments, there are standardized tools that are typically expected. If you don't use them, then your methodology might reasonably be questioned. But immigration evaluation, they are fundamentally different. They are answering psycho-legal questions, like what's the psychological impact of a separation, or what harm has this person experienced, or how has trauma affected functioning? And in many cases, a diagnosis is not even required. The evaluation has to be guided by the referral question, not by a checklist of tests. So who decides what methodology is correct? Who decides that? We do. As long as our methods are grounded in clinical training, clinically sound, ethically appropriate, and clearly explained, then they meet the standard. In fact, some clinicians conduct excellent evaluations with no formal testing at all, just a thorough, well-executed clinical interview, and that is completely valid. Immigration evaluations must answer a specific psycholegal question, and the methodology should be guided by that, not by some arbitrary expectation about testing. So, what do you do when your methodology is questioned? Well, here's my stance. You set a standard, because just like we're not qualified to make legal determinations, adjudicators are not qualified to dictate clinical methodology. They can disagree with your conclusions, they can point out inconsistencies, but questioning your methodology, when it is sound and within your expertise, of course, then that crosses a line. So what I told this clinician, I advised them to write a letter, a professional, respectful, but firm response, explaining their qualifications, their training and expertise, the standards of psychological assessment, and how their methodology meets those standards. So in other words, reinforce that this clinician is the expert and that their conclusions are based on reliable, ethically sound methods that are consistent with Rule 702 of the Federal Rules of Evidence. Now, this actually sparked a really interesting discussion in one of my consultation groups. Some people suggested, in talking about this, we were talking about, well, should we include a statement in reports, like a footnote or some kind of statement saying something along the lines of, all assessment methods, they're used in the aggregate, no single measure is relied upon to form conclusions, or something like that, which is true. But then someone else made a really good point. They said, well, by including that statement, we are subtly accepting that our methodology should be questioned. So, and I agree, that's a valid concern. But so here's where I land. If addressing it proactively prevents delays in someone's immigration case, then I'm going to address it. Because at the end of the day, our job is not to be right. Our job is to be effective. Because this work directly impacts people's lives. And I'd rather prevent a problem or a delay than have to fight it later. Now, this is likely not a one-time issue. It was the first time I heard of it, but I think we're going to see a lot more of this, which means that we need to be clear in our methodology, be confident in our expertise, and be prepared to defend our work. Not defensively, but professionally. Because what we do matters. It impacts real people, real families, real outcomes. And as mental health professionals, we play a critical role in making sure that individuals navigating a very complex and often inequitable system have their experiences fully understood and represented. So if you want to keep having conversations like this, I would love to hear your thoughts. I'd love to invite you to join my consultation group. I host a monthly consultation group every first Wednesday at noon Pacific time. And we have clinicians at every level, from beginners to highly experienced evaluators. And these are exactly the kinds of conversations we have. They're real scenarios, real decisions, real growth, very supportive environment. And I would love to hear from you. Like, what would you do in this situation? So, as always, trust your training, stand by your expertise, and I'll see you in the next episode. I appreciate you spending time with me today. If you enjoyed this episode, share it with a fellow mental health provider who needs to hear it. And if you haven't already, hit subscribe so you don't miss my next one. See you then.